Welcome to Make America Healthy. My name is Beth Shaw, and the goal of this podcast is to educate you, inspire you, and inform you about more ways that you can take control of your own physical and mental health. I'm the author of 4 books on health and wellness, the founder of Yoga Fit Training Systems Worldwide, the world's largest yoga school, and I'm so happy to be bringing you today information on a subject that's very relevant to at least 50% of the population, and that is breast cancer. So today we will be talking with Dr. Joel Evans, who is a board certified OBGYN and an international lecturer, and he is also the chief of medical affairs for IFM, which is the Institute of Functional Medicine, and he's the chief medical officer of geneType. He has a special interest in breast cancer, and as the medical director of the Keep a Breast Foundation, he brings you the latest information on cancer risk assessments and prevention. We're also joined by Chief Science Officer Erika Spaeth, and she's a scientist by training. She's got a doctorate in biomedical sciences and leads the scientific team at geneType. She is passionate about cancer biology and is dedicated to empowering patients to be part of the conversation with their healthcare providers. So today we're going to talk about breast cancer, the importance for women to understand their risk, and a lot of other things. Welcome to the show, Dr. Joel and Erika. Dr. Joel, we'll have you get started because you are involved in a lot of different things, many of which revolve around breast cancer. How did you get started in this field? Tell us a little bit more about you.
Actually, close to 35 years ago, very early on in practice, I diagnosed a woman in her 20s with breast cancer. And that wasn't supposed to happen because number one, she was so young. Number two, the lump was painful. And I was taught that breast cancer is never painful. She had no other risk factors, no family history. It was at that point that I realized there was more to learn. Basically, that took me on a lengthy journey where I learned about things that I wasn't really taught about in medical school and learned about how the body functions. And through that, became interested in functional medicine, mind-body medicine. And as I was learning functional medicine, really started learning about genetics and the role that our genes play in either keeping us healthy or sometimes making us at risk for different diseases. And the way I learned about the impact of genetics would be one gene would cause a problem, and we would know why. So when it comes to breast cancer, I learned about BRCA, and I learned that BRCA does, the gene itself does a good thing. It's a tumor suppressor gene. But when you have an abnormality with that gene, it doesn't work properly. It can't suppress tumors. And that's why there's that increased risk of cancer. So it all made sense to me. And then I started reading about what's called association type causation or associations of genetic problems. And I had conversations with Dr. Spaeth a number of years ago about this new product that was coming to market. It had a different name back then called Brevigen, and it's now called geneType, which looked at a lot of genes and their associations with cancer. You could take this genetic risk that they would calculate and populate, in addition to the genetic risk, you can put in things like weight, family history, and other risk factors, and then you would come up with a personalized risk assessment for breast cancer. And to me, that was so exciting. And I have no problem saying this publicly, but when I learned about this, I called Erika and I said, "You want me to be your chief medical officer, and I can help you promote this because I really understand how important this test is for all women. And specifically, this is for women that are at normal risk, because the women that are at high risk are already plugged into the system. They're getting some sort of increased screening, they're getting some sort of risk reduction, but the average woman has no idea what her risk is. And that's the sweet spot for this test.
Wonderful. And I want to dive much more deeply into the testing aspect because that's how we met. I wandered into a seminar you were leading in Pasadena because, just so all the listeners know, I sneak into a lot of medical conferences all the time. It's my thing. I was there for a fitness conference actually, but your event looked a lot more interesting. So I came in, was very interested in everything that I heard, and thought you would both be amazing guests for Make America Healthy, because as I understand it, cancer in general is on the rise. And you're both doctors. You can correct me if this is wrong, but I have heard that in the past 3 years, cancer has increased 800%. What I'll ask both of you is if there was a pie chart and we were going to divide up sections as to causes of breast cancer, obviously genetics being one of them, but then we have epigenetics, which we can also talk about, risk factors, lifestyle. What does that pie chart look like?
That's a good question. I can start and then Joel, you can jump in.
Sure.
So cancer incidence is definitely on the rise. I can't speak to the 800% specifically. Over the past 10, 15 years, we have seen certain populations increase in cancer incidence, whereas other populations are decreasing in cancer incidence. So we are doing a good job at screening and prevention in some categories, but not in others. It is concerning, and which is why we want to spread awareness about your risk of disease. In terms of risk factors for developing breast cancer, genetics is certainly one of them, but it's not the key. And there is no single risk factor that really dominate. And I think that's a really important fact. And if we were to pull out one risk factor that does dominate risk, it's being born female. That's the number one risk factor for developing breast cancer from a numerical standpoint when we break risk factors down. The next one is age. The older we get, the greater risk we have of developing a cancer. And then as we add on risk factors, family history is certainly a big one. Genetic predisposition is a big one. Age at menarche, which means the age you got your period, is a risk factor.
So can I stop you there and ask you, if you got your period like at 14 or 15, are you at less risk than if you got it at 10 or 11?
Correct. Yes. It's a small amount of risk. All of these risk factors are really incrementally fairly small because all women have at least one of these risk factors, whether you got your period early or late, whether you started menopause early or late,
And
whether you had
are there any
children.
statistics around menopause? If you are in your mid 50s and haven't hit menopause, are you less at risk?
You are more at risk.
You are
So,
more at risk. So the longer
yes.
the period goes, the greater the breast cancer risk.
Exactly. The more, so having children is a risk factor. The more children you have changes your risk. Being on hormone replacement therapy changes your risk. So there are so many different risk factors. Your BMI changes your risk, and that BMI changes depending on your menopausal status of how it impacts your risk. So there's so many nuances to a person's risk of developing breast cancer. So it's not as simple as just having one risk factor like family history. And most women you talk to, you go up and you say, do you know your risk of breast cancer? And most women will say, I don't have a family history. I'm not worried about it. I don't have a risk, which is not true because the majority of women who develop breast cancer don't have a family history.
Both work for a company that does gene testing. That was the presentation that I saw in Pasadena. Can you walk us through this test, why it's different than other tests, what all is involved? And then once you get I'm assuming you get a score, then what you do with that?
I'll talk a little bit about what the test is, and I'll let Joel talk about what you do from a physician perspective. The test itself, what it involves is a handful of genetic markers. And what I mean by genetic markers is there are really two major fundamental pieces of genetics that we currently understand. There's something that patients may be a little more familiar with called the BRCA gene, BRCA1 or BRCA2, and women have the ability to get tested for what's known as a mutation or a pathogenic variant, meaning something went wrong in that gene. And you're looking at one location in the gene where something has broken. Right now, you can get tested for a single gene or for a panel of genes, and there are quite a few genetics companies that offer that type of testing. But those type of mutations are actually very rare in the population. So maybe 1 in 400 women will come back positive, meaning 399 women will not have a mutation, will have a completely normal gene. Those women are still at risk of breast cancer, not of the hereditary risk that would involve a mutation, but at a different level of risk. The genetic component, the next genetic component, is what Joel touched on briefly, this risk. Polygenic means we're looking at multiple markers spread throughout a person's DNA. And we don't know why they are causing breast cancer, but we know that there's an association with breast cancer. And so we can combine all these tiny markers that pop up. Individually, their risk level is negligible. So if I were to just look at one marker, I would say that doesn't matter. That's like a little grain of rice that you can barely see if you drop it on the floor. But when we look at hundreds of these markers, imagine pouring an entire bag of rice on the floor, then you see a messy pile. That's what we're looking at in terms of this polygenic risk that can add up in women. So that's the genetic component that we're focused on. And then on top of that, because genetics is not the end all be all of cancer risk, we also look at the clinical components. So we look at family history risk, we look at the woman's BMI, we look at her menopausal status, we look at her breast density status, which is a big deal. So every woman who goes in for a routine mammogram gets a breast density notification letter. Half of all women get a letter saying you have dense breast tissue. That's a big deal because you can't see tumors as well in tissue that's dense. That's a risk factor that we can incorporate into our algorithm. Ultimately, we take all of these risk factors that I just talked about, and we provide what's called an absolute risk score. We say over your remaining lifetime, this is your chance of developing disease, and a doctor can take that number and act on it. I will let Joel.
So I'm just going to ask you a couple of questions here.
Okay.
Obviously, this is a blood test, correct?
It's actually a buccal swab. So you swab the inside of your cheek.
Because I would imagine that a lot of this is self-reported, right? The buccal swab is not going to know what your BMI is. You have to be honest.
You do.
And be insightful to all of these different things in order to really provide the correct data.
You do. And you raise a really good point. And that's something that went into the design of this test. We talked at the beginning about how many risk factors actually exist for breast cancer. And we didn't talk about exercise habits, alcohol intake, diet.
Formation too.
There's so many risk factors that are harder to quantify and to get actual responses from patients that may be accurate because habits change week over week. So the risk factors that went into our test, we specifically chose ones that were as robust as possible for a patient to say, I know the answer to this, and it's hard to fudge one way or another.
I've run a lot of weight loss groups over the years through my work at Yoga Fit. I find that people underreport what they're eating and especially what they're drinking. Sometimes they don't even report, those 2 margaritas that might have accompanied the taco. So is alcohol consumption a question in your test as well?
It is not for breast cancer. It is not. We don't incorporate that, but we do know it's a risk factor. So again, there are many other risk factors that do exist that we don't incorporate into our risk prediction because we do want to predict the most accurate score possible, which means we need reliable data up front. And we don't want to put a patient on the spot to something they may not answer completely truthfully.
How long has your test been available and how many people have had the opportunity to take it?
Let's see, the current iteration of the test has been available for about 2 or 3 years. We have had previous iterations over the past several years that we've gone through. A few thousand patients have taken the test over the years.
Of those few thousand patients, how many of them have come up with, I'm going to get cancer when I'm 80? How many have come up with a positive, not so positive result?
That's a very good question. So I think that's the difficult part about risk assessment. We aren't a crystal ball that is saying you are definitely going to get cancer. What risk assessment is saying, this is your likelihood over the next period of time. But every prediction, if you have a 30% chance of developing cancer over your lifetime, for example, you have a 70% chance of not developing that cancer, which is something you have to remember. And just because you have a 30% chance doesn't mean it's going to come true. And this is where, Joel, from a physician standpoint, there are things that a physician, a healthcare provider can come in and help make choices with their patient to be able to manage that risk, whether it's additional screening or risk reduction behaviors to reduce that potential.
Thank you for that. I'm just going to interrupt for a moment to say that I had the pleasure of speaking with Dr. Evans in Pasadena, and it was one of the most insightful conversations that I've ever had with an MD in my life. I spent a lot of time around the world of functional medicine, natural medicine, all different types. From the natural medicine they may offer you in South America to what they're doing in Japan, China, India. I've been around the world with this. And I'm not too fond of the traditional Western medical system. I found Joel to be very thought-provoking, very spiritually insightful, and I really felt like he gets us on a very deep level that is much wider and broader than traditional Western medicine models allow. Dr. Joel Evans, tell us what you, and obviously I don't think most doctors are like you, what do you do with a score that says you have a 70% chance of developing breast cancer sometime in your life? What's your prescription? What's your RX?
The first RX, making sure that my patient doesn't go into this place of fear. That's a very fear-inducing number. In fact, I was just talking to somebody a couple of weeks ago that had a 60% number. I am very well aware of what I say now. That, I think, is the highest priority. It's rare to see those kinds of numbers, right? So the definition of increased risk is over 20% of a lifetime risk. When people see a 22% or a 24% or 25% number, they may not immediately have this fearful reaction like a 70% number. But then when I explain that's actually a high risk number, that can then throw people into a fear reaction. So it's important that no matter what the number is, that we deliver this information in a way that makes patients feel that they are cared for, we've got their back, and we're going to help them sort through whatever is going on.
And I would imagine also that it's important for clients or patients to have some sort of agency in the matter and feel like they have some say, some participation in a positive outcome. I spoke on a holistic women's health panel at the DTC convention, Expectives. It's a pharmaceutical conference a few years ago. And I was on that panel with a woman from Arthur Anderson Medical Center, the big cancer hospital in Houston. And she said they put a room in the hospital for yoga, meditation, acupuncture, and women who participated in that, in those activities had like an 80% less chance of pain, anxiety, and all of that. So I was really pleased to see that there are some larger institutional hospitals who are actually advocating for the softer sciences that I believe the mind is in control of the body. I have to believe that. I've been doing this for over 27 years. And also we do a lot of work at YogaFit in the healthcare system in Japan, where we train instructors in 3 hospitals to really work with healthcare providers and clients and patients for yoga for healthcare and yoga for their clients as well. And the results have been amazing.
Yeah. So the technical term that's in use now for what you're describing is co-creating a plan.
Right.
So it's not the doctor telling the patient what to do, it's the doctor working with the patient and they create a plan together.
So what does that plan typically look like if you're prescribing it? And I know, again, you're probably different than most doctors.
So, I just want to circle back to that question of what do you do with someone who's high risk, just to sort of give you the bullet points of that. So the first thing we have to do is make sure that there's no cancer now, right? Because if you come up with a 70% number, like in your hypothetical, I, want to make sure that there's no cancer now. And
So there are tests like this Grail test that I have a lot of friends from Harvard actually who are really advocating for, and other people from other business organizations. What would you refer someone to a Grail test to see if there's actually cancer in their body that perhaps can't be detected with a normal test?
what I would say is that Grail is absolutely part of this process, but it's a little bit further down the timeline because what Grail does is it looks for early cancers. So first we make sure there's not a clinically apparent or clinically obvious cancer. That would be with mammogram or MRI or ultrasound. There are sophisticated newer tests that are coming out. That's the first thing that we do. Then the next way, so then if there's no evidence of cancer there, that's the opening for the Grail test. So then we say, okay, are there just tumor cells around that we may not be aware of? As a company, both and me as a physician, I'm very much supportive of Grail, and we're going to be having some corporate conversations with them because this really is part of the continuum of care. So on imaging, there's no evidence of a cancer, then you can go to Grail, which looks for, the technical term is cell-free DNA, which is the DNA that's floating around that was released from a tumor. The strength of the Grail in terms of breast cancer, they're better at other cancers, but it's still something that I would want if I was in a situation where I had a high number.
And is your test strictly breast cancer or do you handle other cancers?
So we handle not only other cancers, but other diseases. So that's why when I talk to my patients or talk to other doctors that are interested in longevity medicine or optimal health, this is such a great test. So if we're talking about cancers, for women, it's breast and ovarian, and for men, it's prostate. And then both sexes, pancreatic cancer, melanoma, colon cancer, and then in terms of the non-cancers, type 2 diabetes, heart disease, atrial fibrillation.
I didn't make it to the IFM conference this year, but one of my colleagues did. And I noticed that literally every other booth was a testing booth for something. It seems like tests are all the rage. So I would ask, and I know you are all credible individuals, but I would ask for and not even the average consumer, but for someone who has an interest in functional medicine, has an interest in testing. It seems like there are a lot of different things on the market. How does the average consumer find their way through all of these tests?
It's challenging, but what you have to do is look at the sources of information. If you're going to be getting information from a commercial entity, clearly they're going to be biased in favor of the test. So then you have to look at who's working for the company.
If they have some supplements for sale, once you get your test results that will cure it.
That's something that can be interpreted in both ways, right? Sometimes it can be helpful to the consumer. Sometimes it's just a gimmick to make more money. I think the federal regulatory agencies are not in favor of that. In general, I'm not in favor of that. You can sell tests and supplements, but the testing company usually shouldn't be selling the supplements. I think there should be a Chinese wall there.
I 100% agree with you. A lot of people are doing these full body scans now, especially in Los Angeles. Do you want to talk about where a scan falls into this process?
Sure. There's lots of medical literature that's coming on now about these full body MRIs. In fact, there was a paper that just came out yesterday that I read. I'm not decided yet about whether it's such a good idea or not, which is different from having a reason to have a scan. So if you do our test and you have a increased risk of one of our cancers, absolutely get a scan. But to have a scan when you have no symptoms, the likelihood of finding a serious problem is less than the likelihood of finding a problem that has no significance. And when you find a problem on a scan, you don't know whether it's serious or whether it's insignificant. So usually that involves some sort of biopsy or surgical procedure, which has complications, risks, and costs. That's why for me, the jury is still out. I know that I've been offered to have these scans by various people, and I've turned them down so far. I don't want to go down this path of what we call chasing false positives.
It's interesting how many people now really are able to take more control of their own health.
Yes.
As more of these tests come available, of course, insurance isn't covering any of this. It's nice to see that people who can seek it out have options because it
Should. They
didn't
should.
have as many options before.
Yeah. It's all about options. And for someone that wants that, I would never say no.
Like we say at Yoga Fit when we practice yoga, the one with the most options wins. And I really believe that to be true when it comes to taking control of your own physical and mental health care. So, how do we get this test? Is this something you can just order off of a website?
It is available. There is a link available on our website, and it reroutes you to a telehealth provider because this test has to be ordered by a clinician.
Okay.
So a patient is redirected, completes a questionnaire, and then that goes over to a healthcare provider who reviews everything and decides whether or not the test can be ordered. So that is one pathway. And then, of course,
And is it available in all 50 states? Because I know some states are very aggressive about you not doing any testing on your own, New York being one of them.
correct. It is available in all 50 states. In New York, breast and colorectal are the tests that are available.
All right. And tell us what the website is.
geneType.com, genetype.com.
Wonderful. We're going to have a special code for the Make America Healthy listeners, and that code will be healthy. And we'll be putting the link to utilize that code in the show notes, and we'll run it across the screen once this episode goes live. I'd like to thank Dr. Spaeth, Dr. Evans. Thank you so much for educating us at Make America Healthy on what we can do to take better control of our own physical health. We'd also like to thank the sponsors of this show. Our premium sponsor, Previmedica, offers innovative testing for food sensitivities, micronutrient deficiencies, methylation, and other state-of-the-art tests, as well as personal one-on-one nutrition and lifestyle consultations. I've taken this test, and believe me when I say a lot of the things I thought were healthy that I was eating, like arugula and broccoli, apparently I have sensitivity to. So I changed around my whole diet for like 4 or 5 months, and I had a lot less stomach issues and gut issues. And they do nutrition plans to address inflammation, weight and body composition, headaches, breathing problems, and other issues. So I'm a huge fan of this test, and you can get your questions answered by calling 855-773 or go to hello@previmedica.com, or you can visit them online at previmedica.com, and you can use the code YogaFit to save 15% on any of your testing. We would also like to thank our sponsor, YogaFit Training Systems Worldwide, the leader in yoga, mind, body, fitness education, offering corporate wellness for healthcare, and all different types of programs, conferences, online courses, in-person courses, and so much more. You can go to yogafit.com to learn more if you want to take control of your physical and mental health, because we have a lot of therapeutic problems as well that we can solve with yoga, meditation, and other mind-body disciplines. So check out yogafit.com. And again, we would like to thank our friends from geneType for coming on today and educating us. If you enjoyed this show and know someone who needs this information, please share it. Thank you to our listeners. Stay healthy, stay happy. Namaste. Thank you.